The pituitary gland is at the base of the brain, right in the middle of your body, and it controls all the hormones in our body. It's essentially the conductor of the hormone orchestra. So it controls our growth, puberty, fertility, and metabolism.
I think the pituitary gland is the most important organ. It's just 1 centimeter in diameter. It's nicely kept as a small organ in the base of the skull, just around here. So it's nicely protected. And I think it's the only organ of about the size of 1 centimeter that if you remove it, you die. It's used by the brain as a kind of Ministry of Internal Affairs, which means that the brain should be access to all of your tissues and all of your organs. It should control them. It should be able to speed them up or slow them down. So for instance, if the brain decides that a few of your endocrine organs, like the thyroid, the adrenal, lactation, gonadal effects like fertility and menstruation, but also growth, somatic growth, if the brain decides that it goes too slow or too fast, it can use the pituitary to adapt that. So for instance, if you take your thyroid gland, it produces the thyroid hormone. How much? Well, that depends on the messages that the thyroid gets from the brain via the pituitary.
There are essentially 3 things that can go wrong with the pituitary gland. It can grow tumours, and they can cause pressure for a first thing, so they can press on your eyes and cause blindness. They can produce hormones, so they can actually cause syndromes themselves. So occasionally you get syndromes like Cushing's syndrome, which is due to too much steroids. And of course, the tumours themselves can press on the normal pituitary gland and make you underactive in your other hormones. So they can cause infertility, growth failure, or slow metabolism. The great thing about most endocrine diseases is that they are relatively benign and that we have treatments which are very effective in helping patients. So in pituitary disease, if there is a mass there which needs treatment, then surgery can cure people, usually in about 50% of patients. If there's a hormone deficiency, we can replace those hormones. And if there's hormones excess, we also have therapies that we can apply to reduce that hormone excess. So essentially, there are 3 things we need to consider when we're treating a patient with pituitary disease. Firstly, is there a lump in the pituitary? And if so, that might need treatment itself surgically. Secondly, is it making the normal pituitary underactive, in which case we need to replace those hormones? And thirdly, if the tumour itself is active and producing excessive hormones, so if it's producing too much growth hormone, it might cause gigantism or a syndrome called acromegaly, and we may need to specifically treat the excess growth hormone or the excess hormone secretion from the pituitary gland.
The treatment of pituitary diseases has gradually changed over the last few decades, where neurosurgery and irradiations were kind of a standard treatment for most, if not all, of the tumours. For most subtypes now, at least there is 1 or 2 subtypes of medications that are very effective. The Star Trek way of treating patients is the most optimal way. Whatever is wrong, just replace it, just like a machine, and then move on. We're not that far. However, there are now recent reports in which scientists were able to make a new pituitary gland in vitro, which means that it is out of an individual, out of an animal, in lab conditions. So they were able, from stem cells, we are full of stem cells that can do a lot and can still decide what they want to do in the end. Become an eye, become a nose, become a toe. So certain stem cells are able to be trained to form a new pituitary gland. And if then you transplant that particular neo-pituitary out of a dish into a mouse, in which you have removed the pituitary gland. The researchers saw that at least in a few numbers of mice, that particular pituitary that was transplanted started to work and listen to the brain. So there was an active regulation, there was an active crosstalk between the brain and the new pituitary, which is wonderful. Not for all the hormones, and the mice still need an additional replacement for the things that didn't start up. But if this is already possible, what can happen in 10 years from now? And if you then are run over by a car and if your pituitary is destroyed, you just go to a big center with a huge lab, your pituitary out of your own stem cells as cultures, you get all the necessary information, come back in 6 weeks and your pituitary is finished and we just have to put it in.